You know, I usually show this hat at the very beginning of the 2 days because this is my Whiffam hat. And I encourage all of you to realize that this hat is not only for you, but it's for your patients. And it's very important when you're talking to them probably about anything, but certainly about this, because what did Elias tell you? What did Brock tell you? What did John tell you? We're not talking about appliances. We're talking about screening for sleep health. So what's in it for me? That's what the patient's thinking. They trying to sell me something? Or what's in it for me? Am I going to feel better? Am I going to live longer? I'm a very visually verbal person. So I'm going to encourage you to really talk about choking and suffocating, because apnea is the true scientific word, but it doesn't get the point across as much. So think about what's in it for you. Did you come here for the units? Did you come here to learn something? All that's okay. Did you come here to add a new treatment area for your practice? What's your Whiffam? But the patients are thinking this too. So this is a hat, not just for you, but for your patients as well. The other hat that I start off with, which is one of my newer hats, and there's no letters on it, but this is the guy with the gun. You know, because I've been accused before, instead of ready, aim, fire, fire, ready, aim. You know, I've been accused of that personally, because there's a lot to learn here, and you need to learn the lingo and talk the talk, and Monday is not the time, unless it's your brother-in-law or your next-door neighbor, to go out and tell that sleep doc who's across the hall or down the street, send me all your patients. Patience is a virtue in that, because there's still more to learn. You don't always get a second chance. So keep that in mind, that you can build this. You've got a great first opportunity in just screening patients in your office. And if you don't have that opportunity, because some people that come to these seminars don't have a practice that they can screen, a general practice that they can screen patients at, there are other ways to do this. But keep in mind that it shouldn't be fire, ready, aim, that it should be ready, aim, fire. Now, my most important hats are the ones, well, this first one that we all wear. We all wear this hat, whether it says DDS or DMD. We all wear this hat. What we have to learn and what we have to teach our staff is that it's not business as usual, because there are several nuances that successful dental sleep medicine teams learn. One, unless you're an orthodontist sitting here, this is probably the most staff-driven, successful area of your practice, and you have to delegate. And I used to say 80%, and then someone corrects me, no, 90% of this is really dependent on your staff more than you. So that is not business as usual wearing this hat, because most of us, you know, we're shouldering most of the burden in our dental practices. So although I'm not saying that you need to have this degree, but you need to start to think like this. Because everything is what? Diagnosed medically, coded medically, billed medically. You know, it's all the medical niche of your practice. You need to work with MDs. You need to develop those relationships. What do we usually do? We talk to MDs to maybe check on a health condition, see if somebody needs to be pre-medicated for a certain health problem, which has even been simplified by the American Health Association. But we need to know that this is not dental business as usual. We need to understand that we're treating for MMI, maximum medical improvement. We don't have that concept in dentistry. And if you want to be millimeter perfect, margin perfect, so perfect, and guarantee your treatment, like wearing that dental hat always calls for, then you're going to be probably writing a lot of refund checks for appliances. Your staff needs to know, and your systems need to be set up so that you don't expect and you don't guarantee patients, I'm going to fix this. Because you're not fixing it. You're going to try to control it. You're going to try to minimize it. You know, these guys don't have a problem. They sleep at night. They don't fix every patient. Pain control management. It's not pain fixing. Oncologists, their patients die sometimes. There's nothing to make light of, but they accept that they can't fix everything. I think the only thing wearing our dental hat that perhaps we even come close on that is perio. We know in perio that we aren't going to get 100%. We're not going to fix it all. So this is a big, financial arrangements, a big thing of mine. How do we do financial arrangements in a patient and physician-friendly way? We'll talk about that more. But if you guarantee success, you can't be doing financial arrangements successfully for dental sleep medicine because you're going to fail sometimes. And you may not even meet the patient's expectations all the time, but that doesn't mean you didn't succeed by the medical terminology and definition of this. So it's not business as usual. The most important hat that you need to not leave here wearing, or that you need to work on not wearing, is this hat. Because if you leave the seminar or you put this into play in your practice and you're wearing this hat, then you're in nowhere land, no man's land, in between land. So we need to develop the systems to do this successfully. Would I say everything from A to pay? I'm going to pass out some brochures and sheets to show you how we'd like to help you, that we have a program that we do sell, and I'm going to present that here to you. Whether you become a client of ours of Sleep Group or not, you know, I'm going to hand out cards with my email and cell phone. You're all welcome to call me. But very important that you feel for your personality, for your practice's personality, for implementing, if you're going to this area of dental sleep medicine, of sleep medicine in your practice, that you answer the questions, that you set everything out on a path for success. And if you're not going to, because I know we all know that not everybody in here is going to treat patients in this area of practice, that's okay. But now you can't help going back on Monday and looking at the things that we always look at with different questions. Now we're thinking airway. It's impossible not to. It's impossible not to think about airway now, to help direct from kids through adults to the proper life-changing channels so that they can live longer, live healthier, live better, because our awareness is increased by these couple of days. That our awareness is increased so we're not just treating snoring without understanding that that snoring is, you know, the smoke alarm that shows that there's probably fire below. So that's really what I'm here to talk to you about overall. We're going to get into appliances now. I'll come back to these systems. I'll show you what we've developed so that in 2 months, I know we can get you to where a year from now or 2 years from now, you're either banging your head or your staff hates you, and or you give up along the way. Because, yeah, we all of you who decide to do this, it's a great thing. I think it's probably the most life-changing, life-altering, life-lengthening thing in our practices, but we need to get paid for it. And us getting paid for it helps patients pay less if we can maximize their medical insurance benefits. You know, if you help your patients with their dental insurance, if your staff does, if your practice philosophy is such, why would you not help them with their medical insurance? It just takes a little learning process. Do you want them to go back to their medical doctors and their medical specialists and say, well, I got this appliance, but the dentist made me pay for this up front. He wouldn't take my medical insurance. How wide open do you think that's going to put the doors for referrals from the medical world and the staff in those offices? That is very physician unfriendly. So patient-friendly is also physician-friendly, referral-friendly, and I want to help you to think about all that in developing this area of your practice. So let's talk about appliances. We will come back to talking about that in more depth, and I think we're good on the